From managing a common cold to treating infectious diseases, the pharmacist plays a vital role in patient care and wellness. So what does a pharmacist really do, you might ask? Their responsibilities are mainly centered around drug therapies. Drug therapy is the regimen of medications that help assist a patient when fighting disease. The pharmacist also is responsible for identifying problems and risk when it comes to medication, taking into account contraindications and any kind of reactions. The pharmacist is a key player in healthcare plan teams. They provide an expertise in these teams to help facilitate the decisions of the other medical professionals. Pharmacists are also available in many different areas. So, the pharmacist is an expertise in their field. They go through a rigorous training, much like that of a doctor. They are responsible for knowing the ins and outs of medicine as well as medications. They are supposed to know how the medications work in the body and what medications work better for what illnesses. Mayo Clinic highlights that pharmacy is important because they bring a detailed care plan to the patient's treatment. In these plans, they are able to monitor medication and monitor the medication regimen and account for any kind of symptoms and make sure that the patient is adhering to their regimen. During these, they are also able to see if there's any kind of contraindication when taking other medications. The pharmacist is very important in the patient care teams because they help the nursing staff and the doctors with patient care decisions. The pharmacist provides an oversight with medication errors. A journal from the National Institute of Medicine Library has said that with the oversight of the pharmacist, it leads to less medication errors and improves patient safety. Pharmacists are able to help with the policies and procedures when it comes to medication administration and the safe handling between the different departments in healthcare. You may know the pharmacist as the guy in the white coat at your local drugstore, but pharmacists exist in a variety of areas. The AACP, the Association of College of Pharmacy, delves into the possibilities of practice to specialize. Specialties can include things like infectious disease or oncology. This is where the pharmacist has an expertise in this pool of population or this pool of patients specifically regarding the different medications that are specific to them and what kinds of things can happen. Pharmacists are also available in government and in public health. They can help write laws around drug use in government and create safety when new area or new companies want to manufacture drugs. They can also help develop programs for drug issues in the community. Things like the opioid epidemic and things related to substance abuse. Pharmacists are able to lend their knowledge to the policymakers to make it a better and safer environment for the community. The pharmacists exist to benefit patient care. They collaborate to minimize error and to maximize safety. The pharmacist is truly important, and without them, patient care and safety would not be as protected.